evening and welcome to A Deadly Silence. I'm your host, Larry Curtis. It is the goal of all of us associated with our program to bring you current and educational information surrounding the alcohol and drug epidemic, not only here in the city of Brockton, but throughout many of our South Shore communities. This evening, we are pleased to have special guests with us from Gosnold, formerly Gosnold on Cape Cod, for those of us who have been around here in New England a long time. And I'd like to take a moment and, first of all, introduce the new CEO, Richard Curcura. Richard, welcome to Deadly Silence. Along with Richard, we have Allie Anderson. Allie, our Vice President of Outpatient Services, as well as joining us is Erin O'Shea, a Director of Group Programming. Welcome to A Deadly Silence, everyone.
Thank you.
Thank you.
You know, I always want to say this right up front. Gosnold has been a tremendous supporter of A Deadly Silence, and I can't thank the organization enough for their continued support over the last 3 years with our radio show on WVBF 1530. And Richard, I want to again thank everyone of your team for continuing to support us as we go forward.
We're happy to.
It's a great thing. Quick little history. Founded in 1972, Gosnold is an award-winning, nationally accredited, not-for-profit addiction and mental health treatment provider with programs and services that address addiction at every stage. Prevention and early intervention offer the hope and promise of averting addictive disease. Gosnold provides community awareness, family education, medical care integration, and the creation of positive social norms. Treatment is administered in a variety of inpatient and outpatient services, from acute detoxification to comprehensive outpatient care. And recovery management provides support in the critical time after a patient has left inpatient treatment. Online and mobile support and recovery groups for patients and families help to ensure sustained recovery. I think that really covers that whole gamut of the whole addiction recovery umbrella, if you would, as to how you have to reach out and do that.
Well, I mean, that's really the hope of Gosnold. I mean, I think it's the continuum that makes us stand out from, I think, other organizations. I mean, it's not just about detox and rehab. We provide a full continuum of services, really making sure we keep our arms around the patients as long as possible.
I think some of the misconceptions that are still out there in the recovery arena, particularly for parents who are dealing with loved ones who are addicted, is that when they talk about detox, they think detox is the cure-all, that it's going to be the quick 3, 4, 5, 6 day, and their loved one should be okay. But that's not the case, is it?
Well, yeah, you're absolutely correct. I mean, the real work begins at the conclusion of detox. I mean, that's when really we have to provide enough support services and kind of wraparound care for them to continue with their recovery going forward.
And I'd like to say, just not just the patient, but also for the families, because I think that's important as well, is that we provide a number of services to help support the families in this, because I think it's also very difficult on them in learning how to speak to them and work with them and help them.
I couldn't agree more with that, Allie, because the reason A Deadly Silence exists today from my wife Peggy and I is that our 2 sons were addicted to heroin. They are in long-term recovery today. We count our blessings because we know many parents have lost their loved ones. Yeah. But as the parents of someone dealing with a substance abuse disorder, we didn't know who to turn to, where to turn to, what questions to ask, what services were available, and this is the end result for us, is that we went through that emotional roller coaster and we came back and says we need to give something back. You know. So typically when you call them a patient, a resident, what do you more kind of classify?
I think that alone is a topic in itself, but at Gosnold we call them patients.
Patients, okay. So a patient enrolls within your programs, and depending upon their classification will determine whether they're going to be an inpatient or an outpatient type of a service to be provided?
That's correct. Happens? I mean, typically if somebody needs detox services, it's going to be an inpatient service. And that's usually determined when somebody calls into the admissions line. Very skilled people who answer that phone to make sure that we're providing the best care possible. Again, to Allie's point, to the patients and to the families. Making sure we provide the most appropriate level of care for that patient.
And that level of care is for both sexes within your organization? I know some programs kind of focus on the male versus female population. You have programs for both?
Absolutely.
Yep.
It's about a 75%, 25% split in terms of census population. 75% of our programs are male, particularly in inpatient. I don't know about outpatient, but 25% female. Okay.
Addiction is really becoming more focused toward mental health today. I mean, I think we're starting to see a correlation of that, a recognition of that. What is that correlation of addiction and mental health as a disease? How does that play out?
I think the two have been connected for a long time, and as social workers, we kind of know and understand that, and I think that people are just kind of realizing how the two are interconnected, and it's becoming less of an issue, because I think part of it is there's a stigma with both of them, with mental health and with substance abuse, and so to have both is kind of a double stigma. So I think that a lot of times people don't want to talk about what's really holding them back from the continued stay in that sober. And I think that it's really hard that they don't fully always understand what could be triggering. And sometimes it's anxiety or depression or loss that they don't realize how it interconnects. And I think that's part of what a lot of our programs do, is really help people understand what those problems have been and what maybe is holding them up from continuing to move down the path.
I would say 100% of our partial hospital program patients are struggling with both. They're struggling with dual diagnosis, depression, anxiety, much to what Allie's speaking to, PTSD, and we're really seeing and noticing that there's not just substance use, but there's other mental health struggles that are coming into play, and we have to address those.
One of the huge hurdles in the whole recovery arena is how do families pay for the services that are necessary for their loved one. Has that, I'm going to call it a pendulum shift, made it a little bit easier for families to tap into health care, coverage and so forth of that magnitude?
Funding for healthcare is a challenge. It really is. And I think it's beyond behavioral medicine. I think it's in medical services as well, as what people can afford and what they can't afford. And it's hard to imagine that people this day and age cannot afford good care for their families or their loved ones. The reality is that, we accept all insurances. We provide sliding scales. We do whatever we can to try to get that patient the care that they need. We have people call, we have people walk in. We do everything we can to try to get them the services that they require. So, but you're absolutely correct. It is a challenge for families, and it's a hardship. Some of these families have been tapped out financially because their children or their siblings or their spouses have been in multiple service lines and multiple detoxes. So it's hard. But
you do hear many horror stories of families basically, I'm 62 years old, I'm ready to retire, hopefully, God willing, but, spending their retirement monies to try to help their loved ones, and they may send them off to programs out of state or things of that magnitude.
I was going to say there's a number of programs that tout themselves, kind of like you were saying before, 5 days, 10 days, 20 days, and they'll be cured. Yeah. And so people want their family member, their significant other, whoever, to get that treatment, so they're willing to pay. And I think you do that enough times, and then you realize that that's not always the best program. Not always, and sometimes programs like Gosnold that have been around for years and that take insurances can do just as good a job, if not better, because we've been around and we know what they really need. And it's not always the fancy places. It's the ones that provide the services and know what they're doing. And provide more afterwards too, not just not just that detox, because like Richard said, it's more than that. It really is a continuum of services, because if you think about it, the substance use didn't just suddenly happen. No. It's been a long-standing thing. So to have that belief that it's suddenly going to be fixed or cured, it's a process. Just like it was a process to come into that, they didn't suddenly become an addict. it's going to take some time to suddenly learn how to live life again without that substance.
Yeah. How much of focus or a refocus is looked at to the family? Erin, Ellie, you had mentioned the family, how important they are in the recovery process for the person who may be suffering. Is there a percentage ratio or split that you look more toward the person who is suffering with substance abuse disorder or the family, or a combined effort together?
Well, I think at the partial hospital level, which is, really where we're trying to keep people from either going to inpatient or where folks are struggling, I would say we do a really good job of working with the family to identify what the issues are, how we can do things differently. And I think we really work on a treatment plan that is identifying the family as part of that. And we also have a lot of really good recovery groups for families. We have a really great recovery group on Tuesdays that is quite popular. So, oftentimes we work with the families in partial hospital, but then we also separate people out to go to these groups and get additional help, because support is really important.
The reality is engaging the family is as critically important as engaging the patient themselves, because once they're out of our care or out of our sight, it's really the family's help that's going to keep them in long-term recovery. I mean, that's a huge piece of this.
And sometimes they're not well either. Do you know what I'm saying? They have to work on their own recovery to get through it.
I would agree with that. I mean, I can recall many times my wife and I'll say, doing battle over, who was helping or who was enabling, a child during the, substance abuse crisis there. But it's always something that's difficult to measure, because we're born and raised to do anything and everything for our children.
Sure.
How do you say no when you see them suffering?
Yeah, it's real tough for sure. Erin, you talked about the partial hospitalization program. I understand you have a new facility that may be opening up soon.
Yes, so partial hospital it's very exciting. It's something that's new to Gosnold, so we've started it in Centerville, and we're looking to launch it also in Stoughton. So we're looking to do that by June 1st. And, excuse me, partial hospital is really important to us. It's another level of care that we haven't had previous, and it speaks to folks that are coming out of detox and Katamet, our 45-day program, and are looking for additional care and looking for substance use and mental health recovery. We do both medication management and also case management, and we're very excited about what it provides for Gosnold. It's that extra level that we haven't had in the past.
Is this an overnight program at the facility, or more of an outpatient?
It's more of an outpatient. So partial is part of our outpatient program, and like Erin said, it's kind of new to Gosnold. What they've typically done is we have a SOAP program, which is a structured outpatient addictions program, and it's a lower level. So partial really bridges the gap. Our inpatient systems are very highly structured. It's overnight. People stay there. They live there. Katamet, Detox, Miller House, Emerson House. They're there. They're living there. Then partial is a place where they can go during the day and then go home at night. So they can go return with their families. And it's a way to kind of test out how they're doing.
Okay.
Right? Because they've had this structure where they haven't been out in, not the real world, but having to deal with all of the things that happen in life, and the triggers are back again. And so then we have this program that's there that says, come see us during the day. Let's talk about what happens at night. Let's talk about what happens on the weekends. And let's figure out what we can do to continue this change, to continue to move forward and continue down the path.
So kind of, if I was a patient and I was released from the inpatient program, and what happens more often than not, we go right back into the environment in which probably caused us our substance abuse disorder.
Exactly, and it's very jarring.
And if I felt that anxiety building up inside of me, it'd be an opportunity for me to come in and, hey,
we strongly suggest not even waiting, because you're right. I think that people don't realize how structured the residences are. And they don't realize what it's like and those triggers that are out there. We talk about change a lot, but until you're put in the face of, those phone numbers, access to your phone again, calling the people that, were dealing to you, the corner stores, it doesn't really set in. And then when it does, sometimes it's a little too late. So to have this set up right afterwards can be really helpful and beneficial, because we can start right away. They come in, we do an assessment, we figure out what their needs are, and we try to work with them to kind of figure out what the best form is moving forward. We have a psychiatrist, a nurse practitioner, and we have case managers that meet with people individually.
And as part of that follow-up, is there home follow-up that takes place? I know we're seeing in the ERs in particular now, where I know down BI Deaconess Plymouth Hospital, for example, if somebody is admitted as a result of a overdose, typically the next day there's somebody taking a visit to advise them of the different programs and opportunities that they might want to consider going into. Is there additional follow-up that might take place like that?
So there's not follow-up in the form of us going to the homes, but whenever a patient comes in, we talk to them about where they're living, what their living situation is, and the family members that are involved, and we ask them to bring them in, and we do a lot of family and couples therapy sessions with them to kind of figure out, when you're no longer here, what are you going to continue to do, and how can we build the best support system that we certainly can. And I think that involving as many people as possible is always the best, because when you want as many supports as possible, when you're really struggling, you want to call as many people as you can to help you.
Oh, absolutely. What has the impact of, we saw a couple of years back, Governor Deval Patrick talked about the public health crisis of the addiction here in Massachusetts. We've seen the rollout of Narcan now in most all of our municipalities out there today. How has that impacted what's been happening in your area?
Specifically the role of Narcan, or just that? Well, the reality is that I think what we're seeing these days is there's focus and attention on this disease. For the good or for the bad, the reality is that people are paying attention now. Things like Narcan, innovative ways to treat this disease, but the reality is it's still just not enough. I mean, there are issues regarding reimbursement. There are issues regarding attention to the illness, and the world still sees this this disease to some extent as a choice that people have and people choose. When the reality is this is a brain disease, just like any other brain disease. And until the world and the community starts seeing that as a reality, it's not going to get the public attention that it needs. We treat substance use disorder the same way we would treat diabetes. People have to start looking at that.
Yeah, I would agree with you that I mean the biggest knockout there is that, and Allie, you and I were talking about this briefly, is potential change in Section 35, Section 12, and somebody walks into an ER, who obviously has a substance use disorder. Well, what good is that going to do if there's no place to put them? So the availability of treatment facilities just isn't there right now, and it comes back to the economics.
It absolutely does. I mean, there was a time, and neither of these two will remember it because you and I are much older than the two sitting here.
Probably put together.
Yeah, but there was a reality, in the late '80s when there weren't enough psychiatric beds.
Yes.
Because patients were struggling to find psychiatric beds, and then the funding changed, and everybody opened up psychiatric beds. There's no issue finding a psychiatric bed. There's plenty of beds out there. I think until we see a change in the funding for this disease, it's going to be the same issue.
And what we saw last year on the national level was, this great big hoopla of, funding capability, but they didn't put the dollars behind the law. The law was passed, but no funding to support it, Yeah. Mm-hmm.
Well, you and I were talking before as well about, addiction is still seen as something different, and it does still have a stigma, and it's still not seen as brother, sister, mother, although it's changing. It's still seen as, the person on the street corner that's shooting up, and that's not the reality of who we're seeing. We are seeing young kids, we are seeing doctors, lawyers, teachers, all walks, all socioeconomic status, and I think that the rest of the people need to start to understand that and see it, because I think we're really still stuck in who that is and what that population is. And I think it's hurting us for the services.
Oh, there's no question about that. One of the, the observations I've made, and I've seen a couple of articles written on this, when you look at the cultural mix of what's happening out there today. This is a predominantly, I'm going to call it white middle class type of illness that's been taking place, whether it's because there's been discretionary monies to buy the product that's available on the street or whatever. But, it's frightening, to see what's really happening out there, in our middle-class neighborhoods today. Mm-hmm. It doesn't discriminate. This does not discriminate.
And that's really what needs to be put out there, is that it doesn't. And I think when people start to see that more, I think that the changes that Richard's talking about will start to happen. I think that there will start to be more funding behind it, and really people putting money behind the services that people need. Yeah.
Well, it's interesting. I lost my train of thought here for a second. But anyways, we've got about 4 or 5 minutes left here, so I wanted to turn to Richard and say, as the new CEO for Gosnold, what do you see the future happening for Gosnold as well as for addiction and recovery?
So I just passed my year anniversary at Gosnold, so just 1 year. And I can honestly say, and it's not because I'm the CEO of the company, it is a great organization. It really is. And it's a great group of staff. Erin and Allie, I've worked with both of them prior in another organization, so brought them here as part of Gosnold, partly because I believe in what we're doing. So I think that what you will see in the future is a more holistic approach in how Gosnold looks at this disease. And we will pay attention to
mind, body, spirit type of total package.
And not look at this disease in silos, as both Erin and Allie described. I mean, the mental health component and the addiction component really go hand in hand. So we will look at treating this whole individual as opposed to treating them in silos. The mental health component is so prevalent in this disease, for us to overlook it is really negligent to some extent. And I think that what Gosnold is able to do is to really treat the entire individual. With the help of very talented staff, including the 2 I have here, I think that the future for Gosnold looks very bright.
Beautiful. And outpatient services, bigger, stay the same?
No, we will be continuing to grow. I think the need is there.
Oh, I would agree.
I think, as Richard's talking, mental health and substance use, they really do go hand in hand. And just like with anything else, as you become more anxious, you're going to be more triggered. So I think that we're going to look to provide more. We're opening in Stoughton, and we'll look to open some other areas as well.
And that will be on June 1st?
Ish.
A formal
Yes.
June 1st? Okay.
Okay. But we will be looking. And our outpatients grows as well. Our outpatient has actually been always in mental health, I should say. We are predominantly in our outpatient sites, and we do have 8 sites, by the way. And we've newly added on Nantucket. And we provide substance use and dual diagnosis at those as well.
Excellent. What would you say to the parents out there who might be watching this program in a month from now when we air it, if they feel that there's somebody in their family or a loved one, could be a neighbor, could be a coworker, who might be involved in some form of substance abuse?
There's hope and there's help. and we're here to support and bring additional support to any family that is struggling. It's not just an individual disease, it's a family disease. So we all have to work together to get better, to recover.
I agree with you, and I think the family component is almost as strong as the component of the individual themselves, because you mentioned the family needs to heal as well. You know,
we work very hard around that. We have recovery coaches and groups for families, and we work to make sure everybody is supported, and I think that's really important in the process.
Thank you. I think we are about out of time, so with that being said, I want to thank Richard, Allie, and Erin for joining us here this evening, and for all of you out there from us here at A Deadly Silence, we hope to see you again next week.